Good morning, everyone. My topic is surgical audit of manual small incision cataract surgery done by final year junior residents. As far as phacoemulsification and small incision cataract surgery is concerned, small incision cataract surgery is economical and non-machine dependent, and the visual outcome and complication rates are similar in both the surgeries. So it is important for all postgraduate trainees to be trained in SICS to combat the large volume of cataract blindness in our country. This was a prospective observational study carried out on 858 eyes of 611 patients. All the patients had uncomplicated senile cataract. Routine preoperative evaluation along with astigmatism assessment was done. Post-operative assessment was done at the end of 6th week, and surgically induced astigmatism was calculated by SIA calculator. SICS was done by standard surgical technique under peribulbar anesthesia. Majority of the patients were males and right eye was predominantly involved. About 72% of the patients had a preoperative best corrected visual acuity of 6/36 or less. This improved to about 91% of the patients having best corrected visual acuity of 6/12 or more. Common intraoperative complications were capsulorhexis extension, posterior capsular rent, premature scleral corneal tunnel, iris prolapse. Common postoperative complications included corneal edema, anterior uveitis, and hyphema. About 60% of the patients had a astigmatism of less than 1 diopter, and about 25% had between 1 to 2 diopters. So combining these two, about 85% of the patient had a astigmatism of less than 2 diopters. Subudhi et al. Reported a mean pre-op uncorrected visual acuity of 6/120 and post-op uncorrected visual acuity of 20/50 in a series of 339 eyes. Intraoperative complications were tunnel-related, iris prolapse, capsulorhexis problems, PCR, and postoperative complications were corneal edema, shallow AC, updrawn pupil, and residual cortex. Nayak et al. Reported complications in a series of 293 eyes. He reported 14% had buttonholing or premature entry, and another 12% had a PCR. In his series, 63% of patients had a post-op visual acuity of 6/12. So in our study, the surgically induced astigmatism was 1.3 diopters. To the best of our knowledge, after PubMed search, this is the first study assessing surgical induced astigmatism by final year residents. A couple of studies which I have discussed have published visual outcome and surgical complications, but they have not included astigmatism as their parameter. This is important because it affects the quality of life of the patients. Moreover, these residents would be doing surgeries independently after passing out. So astigmatism is a very important area which should be addressed during training. To emphasize, we want to conclude with systematic stepwise training of residents in the first 2 years can lead to good visual outcome and low complication rate. It also leads to standard post-operative astigmatism. And I want to contribute the acknowledgement of all the faculty, senior residents, optometrists, and nursing staff of my department. These are my references. Thank you.
Thank you, Dr. Sanjay.
Did your study include any data about the nature of cataract?
They
They were
there,
simple
but
cataracts.
I have not included because the number of slides and time constraint. That is routinely done assessment, different types of cataract. But usually we give residents not very difficult cataracts, not very hard cataracts.
Okay, so
grade
simple
2 or
simple
grade
cataracts.
3.
Okay, okay, fine.
Was there no lens drop intraoperative?
Sir, this is a final year resident, and we first teach the steps in the first 2 years, and that is why I said only this data is for the final year. And in the first 2 years, we teach them step by
But
step.
for final year students also,
No,
these
we-
800,
they-
no lens drop.
No, because it was being monitored by the surgeon on the TV monitor. Any complication was taken over by the consultant. There was no lens drop in the final year, sir.
Excellent.
Excluded the lens drop
No, no, I have not excluded. In the final
There's
year, there were
not a
no
single
lens
case.
drop.
Not a single case.
No,
Very
because,
efficient students.
because we were monitoring each case under TV monitor. Each step, as soon as there was a runaway X-rays or something, we took over.
No sunset syndrome like this.
No.
Subluxated IOL.
No, sir.
Nothing.
Nothing.
Extent. Extraordinary.
Okay, thank you.
Thank you.